My name's John Parker. I work with Syracuse Orthopedics. I do a little bit of everything. I do a fair number of joints. I fix a lot of broken bones, a lot of complex fracture work. I went to med school at the University of Rochester, and I did my residency at Dartmouth. Every department at St. Joe's is excellent, and orthopedic patients, especially fracture patients, are frequently older or ill and require specialty care in areas outside of orthopedics. And every area at St. Joe's is covered. It's the best cardiac care, it's the best vascular care, and we're able to provide complete care for patients that come into the hospital. The volume at St. Joe's is so much higher than anywhere else in town that it affords opportunities for surgeons to get better and better at the jobs that they do. The point is to do the same work over and over and over again until it's effortless. It becomes like brushing your teeth. It becomes second nature to do the same thing over and over again, and it gets easy. And that's the importance of high volume in a hospital setting, is that when you have surgeons doing the same thing over and over again, it becomes very easy to do a great job. I think the most important thing about St. Joe's, and the reason I love to work there, is the people that are there, and in particular my partners, because they have abilities that I don't see anywhere else, and they have resources that I don't see anywhere else. And it is so great to work in a difficult field with people who are excellent and who have the experience to know what to do next. And there is always somebody more experienced than me to bounce ideas off of and to get second opinions from. And for me, that is everything. That's everything. It's who I work with. Every day that you see patients, every time that you scrub and go to the operating room, every step of every surgery that you do is an opportunity to do that single step perfectly. And a perfect result is nothing more than several small perfect steps put together in a row. And so it's all in the preparation and then the execution of little tiny pieces of perfect. When I'm replacing a knee, when it's time to cut the tibia, all I'm focused on is cutting the tibia and make it perfect, that one step perfect. Then you go to the next step and you make that perfect. And so when you line these little steps up in a row, it really makes a difference in the outcome. The patients do better if you're very cautious and very careful about making every step as good as it can be. It's the little things that make a difference. It's the moment when a nurse gives you 2 more seconds of attention, or asks if she can adjust your pillow, or get you something to drink. It's the x-ray tech that's careful when they move you from the gurney onto the x-ray table. When you're on the other side of the white coat, and you have that opportunity to see that from the patient's perspective, you begin to realize that it is crucial that every single point of contact for patients be compassionate and cautious and thoughtful. It comes down to putting the patient first. You have to have the patient's best interests in mind at every step. And I see that at St. Joe's. As a physician, as a surgeon, and as a patient there, I see a quality of care at St. Joe's that I don't see elsewhere.